Hi, I'm Cheryl Shipley. I'm one of the pregnancy and diabetes educators at the IWK in the Pregnancy and Diabetes Clinic. And my patient this morning, Christy, is coming in to learn how to use a glucose meter. So she has a diagnosis of gestational diabetes, and this is a condition in pregnancy of elevated blood sugar. You would have discovered this from a blood test that your doctor sent you for. Some women are at an increased risk of developing gestational diabetes due to a family history of diabetes, previous large baby, over 10 pounds, previous pregnancy where you had gestational diabetes. If you're over 35, if you happen to be overweight, and certain Asian, South Asian, Mediterranean cultures, as well as Aboriginal, First Nations. So there's a previous gestational diabetes in another pregnancies that's put you at risk. We would ask your doctor to test you earlier in the future pregnancies to pick it up earlier. Having twins. So some of us can't actually even identify any of those risks, but we know the hormones in pregnancy, the hormones produced by the placenta, are actually causing you to be what's called insulin resistant. So just to review normal physiology, when we eat food, our pancreas produces insulin. The insulin helps bring the blood sugar out of our bloodstream into our organs, our limbs. So now in your pregnancy, some of those hormones that are being produced are actually not allowing your cells to take advantage of that insulin, so it's insulin resistance. So it's nothing you've done. You may hear from some of your friends that possibly you're not eating well and this is your fault. This is not your fault. Coming here today is going to allow you to self-manage your gestational diabetes. So this is a glucose meter. You may have seen this before if you have family and friends that have diabetes. So Christy, I don't know if this is familiar to you. So this is free. We're going to give you a meter today, and what we're going to do is give you a prescription for your strips and for these little lancets that go into your lancet device. Do you have a drug plan?
I don't.
Okay, so without a drug plan, I'm going to give you some information on applying for pharmacare if you're eligible, or you can certainly ask for samples regularly. We try to supply patients with samples. These are very expensive, so they may be a limiting factor in your testing if you're unable to get them. So we'd really like to help people achieve results and be able to test, so you do need to have the equipment.
If I did have a drug plan, would it be covered?
That would be covered, and for those of you who have a drug plan, I'm going to give you a prescription like this. This goes to your drugstore, and even if you don't have a drug plan, I'm going to give you this today, Christy, because there may be a time that we don't have the supplies, and then you'll have to purchase those yourself. So there'll be a prescription. This meter is brand new, and it's free. You get to keep it. There's another lab test that goes along with this meter. Even though they're brand new, there's occasional times they don't work accurately. So for us to be testing blood sugars, we really want to make sure we're getting accurate results. So I'm going to ask you to take this paper to the lab today and get your meter checked. That will involve you doing a blood test that I'm going to teach you in a few minutes, and the lab taking your blood, and they'll send me those results. I will only call you if I need to ask you to come in to get a new meter.
And that's just downstairs.
You can come down. Yeah, I would
Right.
prefer that you came to the IWK lab for that right downstairs. Thanks. And the last paper I'm going to give you today is going to be a blood test for you to have this glucose test again after you have your baby. You can have that done 6 weeks to 6 months, but we prefer you get it done within 6 weeks, as you're going to see your doctor within 6 weeks, and then they could give you those results. So on the top part here is all your information for you to book that appointment yourself. It's kind of tricky to know when's the right time for you after you have your baby. So I'm going to give you that. If you lose this or forget it, I will let you know that there are lots available up on the 5th floor where you'll go after you have your baby.
Thank you.
So that leads me to tell you that once you have this baby and you deliver the placenta, those hormones are gone, and this will be gone. You won't need to test anymore, but you will be at a little risk for having type 2 diabetes, so we do really encourage this test after you have your baby. So you'll be following the diet plan the dietitian will be going over with you and trying to be really active. That can all help to achieve normal blood glucose. So normal blood glucose for you during pregnancy is a little different than if you have a family member who has diabetes. So on the front of your book I'm going to give you today, and on this sheet are those levels that we're aiming for. So we call those targets. So our targets are going to be first thing in the morning when you start doing, before you've had your breakfast, we call that fasting. We're going to look for that level to be below 5.2, as well as other meals through the day. We're going to get you to check 1 hour after your meal as well. Immediately after time from the last bite, count 1 hour. I'm going to get you to do another blood test, and we're going to look at that to be 7.7 or lower. Now, if by chance you forget, life gets busy, I would ask you wait the full 2 hours to do your test. We don't actually have a reference value for 1.5 hours. So at 2 hours, you would do your test. If you don't mind putting a little star by your number and letting us know it's 2 hours, we're going to be looking for a number 6.6 or less. So this is going to be in the front of your book. Some girls even like to write it in their book, so it's a good reference. And it's also on this paper. In no time at all, you'll be very used to those numbers. So in this book is a diary. I'm going to get you to record your blood sugars. So as you can see here, we have the days of the week. Here are the meals, 3 meals and bedtime. To start with this testing, we're just going to ask you to test before and 1 hour after 1 meal a day.
1 meal.
1 meal. So what I'm going to ask you to do is every day try to do a different meal. So today you might do breakfast, tomorrow lunch, the next day supper, so that after a week when we review your book, we can actually see the results for probably 2 of each meal. In saying that, if you forget lunch on a day you plan to do lunch, please just do the next meal. Your goal would be to do 1 meal at least each day. So the apple lets you know that's your before meal, the apple core after your meal. So just to review, right before your meal, do a blood test. First thing in the morning, we'd like you to have not had anything to eat since about midnight. Drinking water through the night is certainly okay. And do your blood test right away. Once you eat your breakfast, when you see the time when you're finished, 1 hour from that time that you finished, do another blood test and write that in here. And you do not need to do any blood tests at bedtime at this time. That's just simply there for in case it's needed later. Okay, so that's your recording book. So this is your blood glucose meter, your lancet device, and these are your test strips. And these are your lancets. This is all the gear you need, and this, if you want to open your box, you're going to find your supplies. For you to get your meter out of your package, get your lancet device out, and we'll start. We'll go over everything. And those are your strips. So just a few things. I'm going to start a few things about the strips I want you to know. They do need to be left in this can. So these are test strips for your blood glucose. They look like this. They are both need to be protected from light and from dampness. So they can't get wet and they can't be out. So don't be tempted to just dump them in your case. Luckily, your little case has a spot just to slip them in. So you can just keep them in there. This is your lancet device. It needs to take these little needles. So I'm going to give you one. So just to demonstrate, to remove the cap, it's a little tricky. You don't just pull it straight off. You need to turn and then pull it up. Okay. This little lancet, it looks a little strange, but it just goes in and clicks.
So is it both ways?
No, you have to put the small end in. That's a good question. So click it. Okay. So once we hear the click, we're just going to twist off the protective cover, and what you're going to see is the little needle. Okay. It's very small. Ladies, it's very painless. It's a little pinch, less than pricking your finger with a needle if you're sewing. So I know a lot of you are worried about needle pricks, and some of you may be scared as well, Christy, but we do get to hide it. Yeah, and we do get to hide it. So before I hide it, I want to show you some features on the lancet device. This little blue button is what sends that little needle out to poke you in the finger. If you happen to pull away or you don't get enough blood, you can easily reload it. I would like you to only use that feature for that though, not for multiple checks with that same needle. So we want a clean needle every time. Important for a clean needle so your finger doesn't get a dirty needle in there for infection, and also it's less likely to get sore if you have a nice sharp needle. Okay. So now the other feature I want to show you, reloading, poking. This one is to get rid of the needle, so you can safely go over a sharps container and just pushing down on this bottom, you'll see the needle ejects into your sharps container. Okay. Now if you happen to be somewhere where you don't have a sharps container, you can protect that needle with the cover. Actually, an empty one of these in your case is a great way to store those little needles. They shouldn't go in the garbage. They are sharp. They need to go in a sharps container. So I'm just going to put a new needle in, just so we can go through. Okay, so now we're going to replace the cover. Again, it's sideways and then clicks. It doesn't go straight on.
First,
yeah.
Then click.
Yes. Okay. So now it's not quite as scary. You can't see the needle. The other little feature, there's a dial here at the bottom, which you can set anywhere between 1 and 7, and that is how deep the needle's going in your finger. If you happen to do a lot of gardening, wash a lot of dishes, work in healthcare, you wash your hands a lot, you may need a setting of about 3 or 4 just to make sure it gets enough blood. If you'd like to start lower, you can, and you'll just need to keep increasing it.
Mine's at 4.
I'd probably use 3 or 4 to get the lancet device ready first, and then let's get a strip out of the container. So this little strip has like a piano key on one end and the spot where the blood is drawn in here. By putting the strip in your meter, it will automatically turn it on. The first thing you'll see, it comes up code 25. You can patiently wait for that to go away or hit OK, and it will go away immediately if you're not patient for a second or two.
Okay.
And you need to see the picture of the strip like that with the blood droplet above it to know your meter is ready.
Okay.
If you now need to answer the telephone or you go away, this could time out. So you could come back and get ready to do your blood test, and it could look like this. You cannot get a reading of your blood glucose if there isn't a picture of a strip. You need to take that out and just put it back in. And again, the same thing. You can hit that, and there's your strip. So this is all ready, and we've got our Lancet device. At this point, we would have washed our hands either right before this or even now if you go and wash them. Always try to wash your hands before doing your blood glucose, because you may have prepared some food for a family member, a child. It could be something sweet. Even some of us use a little sugar lip gloss that we use our finger. Lots of things can change your blood glucose, so we want to have clean hands. Now, if you're at work and you can't get to the sink, you can certainly use hand sanitizer, but that is our second choice. So this is all ready. So you want to use a new needle every time, just to remind, and a new site every time. So we're going to rotate the sides of our fingers. The very fingertips are most sensitive, so we don't want to use those. So for me, I find if I use my thumb and kind of squeeze my finger, I get lots of blood to the surface. If it's chilly outside, warm water, warm cloth to bring the blood to the surface, but usually you've just washed your hands anyway. So I'm going to get that ready. I'm going to line my Lancet device up right against my finger. Now, I'd like to do it first and then have you do it if you're okay. So I've got it right against my finger. I'm lining it up, and I'm going to press that little blue button. Then I'm hoping for a nice blood droplet. So that kind of tells me I could have had that on a little higher number. Just check my blood droplet here. So that's not too bad. If you're perspiring because you're nervous, this can be all wet and you need to wipe that off and have a good blood droplet. If it's smeared over your finger, you will not be able to draw it into the strip. So I've got my blood droplet on my finger. I see my picture is still here on my meter. So now I'm going to draw in the blood into my strip. And you see that go right to the end. The meter's counting down from 5, and then my blood sugar will, so 5.0. So now I'm going to take my book. It's 1 hour after my breakfast. So I'm going to write 5.0 in 1 hour after my breakfast. And that's how I'm going to record that blood sugar. So then I'm going to remove my strip. That can go in the garbage. You may be worried that shouldn't go in the garbage, but it's just like if you had a nosebleed. It's nothing bad. The needle is the main thing I want you to put in the sharps. So this I'm going to take away to the garbage. Also, I want to show you a little feature on here, Christy, that will be, if you don't have your book with you, we do have a logbook in the meter. So we press the OK button to get it on, and then we can read last result, all results. Result average is not something you need to worry about, but if I wanted to know my last result, I can press my OK button, and there I have it. 5.0, today's date and time. If I wanted to know all day because I forgot my book and I went to work, I press all results, OK, and we can get a nice summary of our results. Now, I would ask that you use this logbook as your regular way of recording, because this actually helps you to see a pattern. If you look at this book and you see every morning is up, it gives you a little more of an idea that, oh, my mornings are high. If they're in a line in the meter, it doesn't actually give us the patterning as well. Believe it or not, our brain doesn't see that as easily as if we have it written in a book. So I would ask that you try to use this book. This is great if you don't have it with you. And please bring this book to all your appointments and your ultrasounds, because this is a great way just to check in with you. How's your blood sugar? You don't even have to say anything. Give this book. Perfect. Now, you ready to try?
Yes.
All right. So you've got your Lancet device ready.
My Lancet.
Now I see you put your strip in earlier, so
Yeah,
it's
so
timed
it's
out.
gone now. So I take it out
Yes.
again, put it back in.
And you would wash your hands. That's a very important
Yes.
step that we're not doing here. Okay.
My hands are fresh, washed.
Okay.
So that's ready.
Yes, and you have your picture.
Yep.
Okay. So we're going to alternate the side. So if today you use this finger, maybe later today you'll use this, and go through. You can use both hands and both sides of both fingers, of all fingers.
Okay. So now I press the blue button.
Yes. Now I want you to find a spot on the side of your finger and line that right up, and then when you get it nicely against your finger, press that blue button.
Oh, I didn't even feel it.
Okay, great. Sometimes it's the thought of the needle, and sometimes it can
Yeah.
pinch a bit more. Draw that into your meter.
All right.
How did that go?
5.4.
Okay, so that's great because you've had your lunch today.
Mhm.
So this is 1 hour after lunch. So this is a great reading because it needs to be 7.7 or lower. So then you take the section of your lunch book and you'd write 5.4 as an after lunch reading.
Okay.
So then tomorrow, maybe pick breakfast. I'd get you to get up in the morning, wash your hands, do your reading, have your breakfast. 1 hour after the last bite of your breakfast, check again. You're going to write that reading there. So really 1 meal a day for that first week until you check in with your dietitian. She may give you different directions based on what these readings are. For example, if every morning your level was high, we're probably going to ask you to check every morning. And we may increase the test, but for that first week, just 1 test a day, alternating the meals is perfect.
Okay.
And bring your book with you to all the appointments so that your doctors and caregivers can have a peek at those. Do you have any questions?
What would be the normal values in pregnancy?
In pregnancy?
Before and after.
Oh, sure, I'll review those. So they're on the front of the book.
Okay.
So when you start your day, I want to remind you that fasting is actually not eating through the night.
Mhm.
So sometimes when we're pregnant, we're a little hungry at 3 in the morning, and you might even feel like you want to eat. But I'm going to ask you, if you do that, to write a note. Let us know that you did have something to eat because we'll know that value will be higher.
Okay.
So fasting, nothing to eat since about midnight, 5.2 or lower. And that's the same reading we're looking for before all meals, 5.2 or lower. 1 hour after a meal, 7.7. If you forget or it gets busy at work or something, you have to go for 2 hours, we're looking at 6.6. So you may practice with a few foods in the next little while and see how they work. Reasons that you're here today, if you tend to have high blood sugar in pregnancy, we do know that that blood sugar goes across to your baby, and that's kind of like feeding your baby extra food, so your baby can actually get larger. And the other thing, just like you are thirsty and drink more, your baby can drink more amniotic fluid, produce more urine, therefore have extra fluid around the baby. So both of those things we know are a risk for you going into labor early, as well as the fact of having a baby over 10 pounds. Most of us don't really want to have a baby over 10 pounds, so we're trying to have an average size baby. And the very third reason would be when you have your baby, you're in the delivery room, your baby's producing his or her own insulin based on the blood sugar that you've been sending to the baby. So once the baby's born and we cut the baby's cord, they have insulin on board that takes a while for them to adjust. So we're a little worried that they could have a low blood sugar. Really great because you're self-managing your care. You're responsible, you're the one eating, you're being active, and then you're going to see how that plays out when you take your blood sugar and write it down. So for me, I really think it's great that you can feel like you're managing your own care and taking care of things.